Authorities have restricted access to the website of online gender clinic GenderGP, citing public health risk concerns and alleged regulatory breaches. GenderGP, a teleconsultation platform established in 2015 by English physician Dr. Helen Weberly, provides services such as hormone therapy and puberty blockers. Although GenderGP is a registered entity in Singapore, it is not licensed under the Healthcare Services Act 2020, according to a joint statement from the Ministry of Health and the Infocom Media Development Authority, reported by CNA. An archived version of GenderGP's official website states that the platform is owned by Singapore-based GenderGP Private Limited, a global organization offering advocacy services for LGBTQI+ individuals worldwide. Authorities confirmed on 4 December 2024 that GenderGP's prescriptions and services are not recognized locally. There is no assurance that GenderGP's services are safe or effective, the statement said. MOH noted that the clinic's doctors are not registered medical practitioners in Singapore. The platform came under scrutiny after MOH found that its foreign-based doctors conducted teleconsultations and issued a prescription to a user in Singapore. MOH issued a warning to GenderGP on 22 October, demanding a halt to its services for Singapore-based clients. Authorities stated, GenderGP has been warned not to reoffend, and violations could result in fines of up to 100,000 Singapore dollars, imprisonment of up to 2 years, or both. Harsher penalties apply to repeat offences. IMDA subsequently acted to block access to GenderGP's website, citing public health risks. Visitors to the site are now met with a pop-up message indicating that the clinic's services are unavailable in Singapore. GenderGP has faced significant controversy in the United Kingdom. In 2017, Dr. Weberly was temporarily suspended by the UK's General Medical Council following complaints about her clinical practices. In 2018, she was convicted of operating an unregistered medical agency. Although her suspension was overturned in 2023, her license was revoked in July 2024 for failing to comply with revalidation requirements. The clinic has also been accused of prescribing sex-change medications to minors without parental consent. Investigations by The Telegraph in 2021 and BBC in 2023 highlighted cases where minors were prescribed high levels of hormones without adequate medical oversight. These incidents were raised in the UK Parliament by Scottish politician Neil Hanvey. Authorities emphasised that Dr. Weberly is not licensed to practice in Singapore. Foreign doctors seeking registration in Singapore must provide a certificate of good standing from their professional authority and disclose any disciplinary actions. MOH and IMDA warned against using GenderGP services, stressing that telehealth services without prior medical evaluations or clinical assessments are unsafe. It is clinically unsafe and inappropriate for persons in Singapore to seek telehealth services from GenderGP without any prior medical examination, clinical evaluation, or blood tests, the joint statement noted.